Ask JJ live Q&A. Hashtag Ask JJ has been a bit light recently, now I think about it. Nevertheless, I'm not going to make a big deal about it because, you know, I think it's got enough traction now to be, you know, common parlance amongst those that are in the know. But anyway, yeah, if you've got any questions, then feel free to hit me up with them, basically, because I will do my level best to answer them. Tidy the desk. You can't see the desk, which is probably just as well, because a little bit of just gets clogged up so quickly. So yeah, if you've got a question, please ask. I would say, is my audio working on Facebook? Now I've got one eyeball, so I think I've got one person watching on Facebook. Is my audio working on Facebook? Nice one, sleeve by Dr. Ergin. I'm very well, thank you. Are you chilly? No, do you know what, Corinne? I've got to be honest with you. It looks warm outside. I always feel it a bit cold. I don't. Is it me, or is it not quite as warm as you might think? So yeah, got my poncho on because I'm a little bit, you know, just takes the chill off. Yeah, very, you know, I'm, you know, I often wear a scarf and things because I do feel that the temperature is not as warm as it looks. I don't know if that's just me, but you know, I'm just as God made me. So you know, can't change that. So anyway, we've got some questions going on. I don't. Last week they said the audio wasn't working. 212, is the audio working? 212. Play test sound. There you go. So test sounds played. So I'm hoping the audio is working. Never cast a clout. I think it's clout, isn't it? Till May is out. Yes, and May is not out, is it? No, exactly. Well done, Bex. I agree with that. So we're kicking off with quite an exciting one here. Oh, it's working. Thank God for that. Thank you, Sarah. Very kind of you to let me know. Because yes, I have heard that, Bex, about not casting a clout till May is out, and May clearly is not out yet. So what we got here is we've got a photo. So first of all, I want to thank this individual for letting me show their photo. It's up on, look at that. It's up on Facebook and it's up on Instagram. You thought this couldn't get any better, and I don't know about YouTube. It's on YouTube as well, but look at that. Look at that for tech. So question, why is my tattoo not suitable for excision? So we get, we were talking to someone about, I was talking about someone the other day who wants to do an article on tattoo excision, and we get a few tattoos a day, basically, sent to us, photos, and very happy to receive photos. If you have got a tattoo and you want to know if it's suitable for excision, please send us a photo. But the fact of the matter is, I don't know what the exact number is, but it's going to be something like 90%, maybe more, maybe 95% are not suitable for excision. And don't want anyone to get upset with us. So I always say, look, if they want us to show the photo, let's show the photo. 2121. Look at that wobble. You know, so I can explain myself. I mean, this, to be honest with you, sometimes they're a bit borderline, but this is not a borderline one. So this is the back of the legs. If you're not orientating yourself, you can see the crease of it behind the knee, and this is a very large tattoo. So the criteria for a tattoo to be suitable for excision is the location and the size. So it's not just one or the other, it's both. So a big tattoo in a good location might be able to excise, or a small tattoo in a bad location you might not be able to excise. And this is both a big tattoo, it's too big, and it's in a bad area. It's crossing a joint, which is a terrible thing to do, to make a scar cross a joint, because it would mean that it could restrict the movement if the scar contracts, and it's just huge. So it's just completely not suitable. It's way too big, and you just would not want to give someone a scar going all the way down their leg. So really, this is actually quite an easy one, and I find it kind of obvious that one's not suitable for tattoo excision, but maybe it's not obvious. I mean, I always say that laser is the first line of treatment for tattoos. So I would say to this patient, laser would be the first line of treatment, but I understand why some people, maybe it doesn't work, or it's painful, or it takes lots of goes at it. Excision is often one session, although this one's so big it wouldn't be one session, and it's guaranteed results. But yeah, this is not suitable because it's way too big and it's on the leg, which is a really bad area. There's not enough spare skin on the leg, and I wouldn't want to put a scar going down all the way down the back of the leg there, particularly crossing over the joint, because if a scar crosses a joint and then it contracts, it can make it tight to move basically, and you wouldn't want to give functional problems. So yeah, but I would like to say thank you very much to the person for letting us show the tattoo. I do think it adds another dimension to these. I think you'll agree. Give me a thumbs up if you agree. Thumbs up. Okay. Anyway, I think it does. I don't even know how you give a thumbs up, to be honest. So there you go. So whoops, what have I done there? I've dropped myself down. So let's put that away. Let's move. Oh, we got a thumbs up, Corin. Thank you, thumbs up. There you go. So Corin agrees anyway. So Corin and I like the photos. How do I now get rid of the photo? That's the next question. Stop sharing. There you go. So Sarah's got a question here. We've got the two Sarahs on Facebook. Welcome. How long after a tummy tuck can you get a tattoo to cover the scar up? 3 months. Sometimes I find the tattoo people are often more cautious than we are. I mean, once the scar's completely healed, it'll probably still be a bit red at 3 months, to be honest with you. So 6 to 12 months, it'll be like starting to fade properly. But I would say minimum will be 3 months. Depending, I mean, everyone heals differently. You might be a bit sore, might still be a bit red and active. You probably wouldn't want to do it while it's still quite red and active. So minimum 3 months, maybe 3 to 6 if it's taking a bit longer to settle. But yeah, perfectly reasonable if you want to do that to cover the scar. Is tummy tuck a dangerous procedure? What are the risks? I mean, if you're asking me bluntly, is tummy tuck a dangerous procedure, which you are, then I would have to say yes, it is. It is a dangerous procedure. It is up there, to be honest with you, with procedures which have risks and significant risks. So there are different sort of different, like I should have prepared this, shouldn't I? There are sort of minor risks and major risks, if you like. So the minor risks are things like wound healing problems, scar's not only a risk, it's a definite. Dog ears, little bumps. So these are all risks. You could get a hematoma, blood collecting inside, you have to go back to theatre. Seroma, wound fluid collecting inside, you have to have it drained off. Niggles and nuisances. So these are sort of minor problems, but there are also potentially significant risks with tummy tuck. And the thing that we really worry about with the tummy tuck is DVT. DVT and PE. That's the big thing that's going to cause significant harm / fatality. I mean, it can be fatal, a DVT. So it's not, dog ears and seromas and hematomas are a nuisance, but a DVT is a significant complication. And you can get a DVT with any surgery. So it's a risk with any operation because it's a risk with immobility. It's associated with immobility. So if you're lying there for a while, you're not moving, so your blood can clot in your veins, usually in the veins of your legs, while you're not moving, because normally your leg muscles are pumping the blood round. Now, with a tummy tuck, because you are putting tension on the abdomen, because you're closing that abdomen tight, you're reducing the venous drainage from the legs. So you're increasing your risk of DVT. So a tummy tuck has got a higher risk of DVT than another operation, than another operation that doesn't put tension on the tummy. So that is the real reason that a tummy tuck is a dangerous procedure. And there are lots of things we do to reduce the risk of DVT. We use Flowtron boots, which are these things around your cars that blow up. We put these stockings on. We give you injections of Clexane to thin your blood to reduce your risk of clotting. And really the best thing to do to reduce the risk of DVT is early mobilization, getting up and walking, basically. The sooner you get up and walk and move, the less likely that you're going to have a DVT. So it's a significant risk and it can be fatal, and that therefore does put tummy tuck in the category of a dangerous procedure. Having said all that, it's not that common. Never had one, never seen one like a DVT, that is. So have I seen one? I've seen one in other operations, but not for tummy tuck. So it's not that common, but it's something that we really do worry about because it is such a potentially significant complication. So yeah, so it's not to be taken lightly. I don't think any operation is to be taken lightly, but I think in the risk world, tummy tuck is up there. So it's just like anything, you have to balance it against the benefits, don't you? Risks versus benefits. So yeah, I hope that's helpful. Don't want to be too negative about it, but it is something you've got to consider. Sarah, what you got? Will having type 2 diabetes make healing slower? That I'm on medication and insulin, but I have managed to get my diabetes under control and down to 35. So diabetes down to 35. Anyway, Sarah, in itself, diabetes will not make your healing slower. No. The medication you're on for diabetes will not make your healing slower. Your healing will be fine. You have the main reason for diabetes being a problem for surgery is, well, the two things. First of all, your sugars can be affected by having surgery. So you have to maintain and control your sugars during the time that you're having surgery, because there'll be a period where you'll not be eating and things like that. So that's the first of all, we have to maintain those sugars. But the other thing is you're going to have an increased risk of infection. So if you get an infection, then yes, your healing will be slower. So it's a bit of a sort of secondary effect of it. It's not a direct effect, but yes, you have got a higher risk of getting infection, and infection would mean that you would have an increased risk of it taking longer to heal. So I guess in that way, I guess you could say it's going to make your healing slower, but as I say, it's not a direct effect. It's the risk of infection that we worry about. So yes, you need to get your healing, your insulin right, and your diabetes right. You also need to get your weight right, because having a higher weight will increase your risk of wound healing problems. So your weight would have an increased risk of wound healing problems. Specifically the diabetes, it's mainly infection that we worry about with diabetes. Jackie, what have you got? Jackie says, I had a tummy tuck 5 weeks ago, was never given blood thinners. Is there still a risk even now? No, it doesn't matter, Jackie. You don't, I mean, it's not 100% of people get blood thinners. There is obviously, well, maybe not obviously, but there's a risk with causing a hematoma with blood thinners. So some surgeons are a bit, well, we're a bit sort of, should we give blood thinners, should we not? Because the blood thinner will increase your risk of bleeding, and you just had an operation where they've done lots of cuts, so we don't want you bleeding, particularly forming hematoma and things. So it's not like everyone will get blood thinners, but the main risk is the first days and weeks. So I think 5 weeks you're pretty much out of the woods there, Jackie. Hopefully you're pretty mobile. And I wouldn't worry about the fact that you weren't given blood thinners. As I say, people might just use Flowtron boots and early mobilization and TED stockings and things like that. That's perfectly reasonable to do that, to just encourage people to get up and about, particularly if you're worried about bleeding. There's always a balance with these things. Sorry, I've just realized I missed something on here. I saw it come up. Bex has got, is tummy tuck similar to hysterectomy, which I've had, as in pain and recovery? Bex, I think so. I did a poll on my Facebook. I've got the Facebook page for patients who've been to the clinic. I did a poll a while ago saying which is worse, tummy tuck or hysterectomy, obviously for those who had both. I think it probably I'm going to say it's about the same. Now, hysterectomy, you cut through muscle. You don't cut through muscle with a tummy tuck. But hysterectomy, you don't cut any skin out. So you don't have that sort of tight skin closure that you get with a tummy tuck. So it balances itself out. So I think it's about the same. I've got a feeling quite a few people said hysterectomy was worse. But I think it's up there. It's a similar sort of order of magnitude as a hysterectomy. Quiet in the kitchen tonight. Hope you don't tell them off, lol. No, they're all tired, Bex. They're in there doing exams and stuff. I think everyone's tired. So yeah, it's a bit, not much going on back there, is there? God, no, I haven't told them off. I've told them off to do anything. How long do you recommend to have maintained a weight loss to have a tummy tuck? I'm nowhere near the stage of this yet, but just out of interest. Ideally, ideally 6 months would be the ideal. You really need to be true to yourself, because if you have a tummy tuck and if you put on weight after your tummy tuck, then you're going to affect the result of the surgery, basically. So, you know, your surgery, you'll pay all that money, you'll take all that skin off, but the skin will stretch again if you put weight on. So that is a worry if your weight is generally up and down. It is a worry that if you're not stable, that you might put weight on again. So it's really to protect you rather than for any other reason. So if you've lost a significant amount of weight, you need to make sure you're metabolically stable and you're not in a sort of breaking down sort of stage. We call it catabolic. When you're losing weight, you're in a catabolic state, so which isn't great for wound healing. So you want to make sure you know, if you've lost significant weight, that you've maintained in terms of your mineral, vitamin intake and your nutrient intake is enough for you know, for adequate wound healing. So 6 months, I would say, is the norm, is the ideal. It's not written in stone. It's discussable with the surgeon. But yeah, I see maintain 6 months after goal weight. There you go. Bex agrees with me. There you go. Good to have a bit of independent agreement there. Do we offer mini facelift with SMAS Lift? No. Do I need to? You're welcome. You're welcome, Soph. Is it Soph? Do I need to expand? So no. I mean, I decided a long time ago, really, like 10, probably more, 15 years ago. God. I saw myself. I was in Liverpool yesterday, and I went to the hotel, and I saw the camera at the reception, and I saw myself on the camera at reception, and I thought, who's that old guy standing behind that woman? I realised it was me. Good God. I think it's the beard. I think the poncho ages me a bit as well, but 10, 15 years since I've done this sort of stuff. Good God. So anyway, yeah, ages ago, basically, I'd said I'm not going to do faces, so I don't do faces. So yeah, mini facelift, SMAS lift, things like that. I don't do it. Just do breasts and body, tummy tucks, breast stuff, tummy stuff. So yeah, so I can't really expand on that. Good luck with that one. Get a face guy with that. Sarah, what's going on? Thank you for answering my diabetes question. I've lost 3.5 stone. Wow, well done. I've got down to 11 stone 5 and got my BMI down to 24. Wow, awesome, amazing, Sarah. Yeah, BMI 24. What are you on about? You're just showing off now. BMI of 24 is amazing. I mean, the main number we work on in terms of BMI is 30, but even then, that's not written in stone. So BMI 24, Sarah, is amazing, and you lost 3 stone. Well done. But as said earlier, good to maintain that. But absolutely, if you that sounds like you'd be a great well, I say you'd be a great candidate. You'd be a great candidate for somebody like if you've got excess skin and fat on your tummy. But yeah, absolutely, and that's fine. And yeah. Oh, but the diet, that's right, the diabetes thing. So you still got that, but you got your weight right. So that's brilliant. Well done on that. What's going on here? What's going on? It's okay. I'm in control. Bex, what you got? I'm 6 months post-op sleeve, not at goal yet, but looking forward to reduction in TT. Yeah, get yourself there, Bex. I lost 3.7 stone. BMI is high at 33. Yeah, we're doing well. You're well on track, I would say, Bex. You are well on track. So well done, you. Pat yourself on the back. Give yourself a gold star. 3.7 stone, everyone. Sarah, 3.5. So we're doing well tonight. We've got good weight loss stats on the chat tonight. So well done, everyone. But yeah, keep it up, Bex. Keep it up. What we got here? I cannot tolerate sedation drugs, in brackets Propofol. But I would like a breast reduction, spelt wrong. What are my options? Where is Laren when we need her? There's a few, Laren, if you're watching, there's a few spelling mistakes here tonight, my friend. You could argue I could have changed them when I typed it in, but I just copied and pasted, which but anyway, point in question, breast. I think the breast spelling here is a small town in France, and I think it's traditional to put an A in breast. But anyway, we're going to gloss over that because we're professionals. So cannot. Now, to be honest with you, this is an anaesthetist question. I would imagine it's all right. I don't know what that means. I cannot tolerate sedation drugs, Propofol. What does it mean, tolerate? I mean, does that mean allergy? I'm sure there's some other options rather than Propofol. I mean, Propofol I know is a common thing, but there'll be loads of other options for anaesthetic, he says. I mean, to be honest with you, we would check with the anaesthetist, full disclosure. I don't know anything about anaesthetics. I'll be honest with you. Surgery is the thrust of my business. Anaesthetics, but I tell you something, I know a guy who does. So if you want, whoever, I don't know who this is who's asked this question, but if you want to know, then we could get in touch with someone. We could talk to the anaesthetist and say, look, is this going to be okay? And I think they probably want to know a bit more about what the not tolerating sedation drugs is all about. But I will, in principle, probably. All right. What's going on here? Gastric fantastic. Well done, girls. Susie, loving my new tummy, JJ. Thank you, Susie, for commenting. You're awesome. Well done, everyone. Any weight loss ladies know how I can get my weight moving again? I'm on a 2-week stall. This is what we need. This is what we had last week, Bex, didn't we? We had a bit of interaction. We need some weight loss people to tell Bex what to do. Here we go. It's Soph straight in. Soph not messing about. Soph's on it. 2 weeks of no loss is normal. Just keep going and follow the process. Lots of water and protein. Let's double thumbs up that one. Snap that, yeah. Right, nice one, Soph. So gastric fantastic can help. There you go. Look at that. It's flooding in now. 2 comments within moments. That is the power of when you get access to an influencer like myself. I can connect people. Yeah. So look, Dawny's just joined. Good to see you, Dawny. Right then, what we got? Diabetes question. How long, Sarah? Confusing now. We've got 2 Sarahs, but we can work with it. We'll go with Sarah B and Sarah G. So this is Sarah B. How long after breast reduction? Spelt right. Amy, take note. Would it be safe to fly? Safe to fly? Brackets long haul. Right, Sarah B. Bottom line, nothing's going to happen if you get on an aeroplane the day after your breast reduction. Right? I'm not saying to do that, but nothing's going to happen. Number 1 point. So you can fly at any point. So if something happens, once you're healed, you can fly. Now, what I normally say is like it depends on what you're flying for. So if you're flying for so I'm opening up this question a bit, Sarah B, because I know you've said long haul, but anyway, let's say you didn't say long haul and just said flying in general. So if you're flying to go somewhere like short distance and you're going to go for fun, like for a holiday, for instance, then I would say, look, why put yourself through badness? Why put, you might be able to fly at 3 or 4 weeks, but it's going to be uncomfortable. You want to be fully mobile because DVT and PE, like we spoke about earlier, clots in your legs, is a risk with flying. So you don't want to multiply your risks of having recently had surgery. So I would say a minimum of 6 weeks for you to be comfortable, for you to carry bags and things like that. Now your scars will still be red, your shape won't be right, and things probably won't be fully settled at that stage, but you'll be on the mend sort of thing. But if you wanted to fly sooner, you could if you had to. Now, long haul, a bit of a different thing. Again, it depends. If it's work, you might be doing it a bit sooner than if it was for a pleasure trip sort of thing. So if it's a pleasure trip, so I'd say if it's work, for instance, 3 months, I would say would be 6 weeks would be reasonable if it was work and you had to get back at the earliest available time. So I think 6 weeks would be reasonable to say you could think about flying long haul, although I think it'll be a big deal. It depends on what the work is. If you're just going for a meeting sort of thing and not doing a big deal and then coming back type of stuff, then maybe not too bad. But if you're like doing something quite active, or if you're actually working on the plane, then you might think, well, crikey, you want to be doing 6 weeks. You're just starting to doing lifting and stuff, so maybe a couple of months for that. But if it's a pleasure thing, then I would say, or if you're doing heavy things or doing lifting and stuff with your work, I'm probably going to say more like 3 months would be like when you're starting to feel a bit normal and you might want to travel long haul. So if you had to 6 weeks, if it was like optimal, I reckon 3 months, you're starting to feel human. It's starting, probably won't be fully settled even then, but you're starting to feel better about 3 months. So yeah, that's where I would go on that. Now we've got, that's Sarah B, we've got Sarah G, and now we've got Sue P is in. Sue P, can you have breast implants removed and fat transfer in one surgery? Yes, you can, Sue P. Yes, you can. Yeah. The only thing I would say, Sue P, in my hands, full disclosure, just my opinion, fat transfer is subtle. So I don't know how big your breast implants are, but you're looking fat transfer, you're looking in my hands, 80, 100, maybe 120 cc's per side. Average implants might be 250, might even be 350, might be 400 cc, you know, so it's not as much as an implant, so it will be smaller. So you've got to think about that and factor that in. So if you're having implants removed and fat transfer, it's going to be smaller. So you've got to think, is the shape of the breast going to be affected? Is it going to droop and things like that? So, you know, in my hands, in my experience, you can't quite put back the volume of an implant with fat transfer, although you can do something and have some volume. So you've got to balance that up. Obviously, it depends on how big the implant is, but generally speaking, the people with much smaller implants will have less volume to take the fat from. So it's not like, oh, it's okay, my implant's only 150. Then I'm thinking, well, you're probably quite slim. If you've got 150 cc implant, you're probably quite slim. You probably haven't got much fat grafting. So that doesn't make it. So I'm probably not going to be 80 to 120 with you. I'm going to be like 50 with you, you know, for the fat graft. If that makes sense. So less fat graft. That makes sense. So yeah, can be done, but you have to be realistic about your expectations. That's the word. Right, what's going on here? I can help. Yes, please. Gastric, fantastic. Oh, Bex wants help. With a balloon, you can't. With a balloon, you can't fly no pressure like a helicopter. Okay. There you go. With a balloon, you can't fly no pressure like a helicopter. Do you get pressure with a helicopter? Maybe you do if it goes up high. Well, there you go, guys. Didn't know that. Does the TT involve drains? And you mentioned the injections afterwards. How long is this usually for? I hated the injections post-sleeve. So the TT in my hands does involve drains. So there are people who are using no drains. And I think the movement is towards no drains. For general, and I am moving myself towards no drains, but the tummy tuck is one of those ones where I still do use drains. So I do use drains for tummy tuck, and the injections is until you're fully mobile, until you're out of the hospital, which is usually, to be honest with you, one night. So just usually one injection that night of the surgery, to be honest. So it's usually just one night in your tummy, injection in your tummy, and that's it. You go home. You don't go home with the injections. We don't expect you to do it yourself or anything like that. So it's just usually probably just one injection that night, just to do that. So yeah, not a yes. Plane is fine. Plane is fine. Oh God. So plane is fine, but helicopter's pressurized. There you go. Who knew that? Not me. Let's say there. So T's here. Good to see you. So yeah. Can't fly no helicopter. You can't fly no helicopter after a sleeve, guys. Come on. Get out your helicopters, people. Right. Sarah Bourne. I'm a nutritionist. Can be many reasons. Oh, God. What was that? What was that referring to? I'm a nutritionist. Can be many reasons. I'm out of sync with the... I'm a nutritionist. Was I talking something about Sarah Bourne? I know what it was. It was Bex has stalled with her weight loss, wasn't it? Yes. So there you go. I think that's what it was. So Sarah says to Bex, it's because there can be many reasons. Maybe me not losing after sleeve. Maybe me not losing after sleeve. Great, thank you. Doing the injections myself was a hard part. Oh yeah, well you didn't do injections yourself, so. Sarah G, I cut my carbs down, which knocks the pounds down. Getting lots of advice here. Sarah B, a holiday. A holiday. Oh, was that the long haul flight? So I'm going to say 3 months if it's still a holiday, Sarah, because you just want to enjoy your holiday, because it's a big deal. A long haul flight for a holiday, it's a big deal. I would give it 3 months. That was in answer to the weight stalling. Yeah, I got that. So the weight, so sorry, I got there in the end, Sarah. I got there in the end. So yeah, so the weight stalling is many reasons for that. I eat in my sleep. I'm not joking. Right. Carbs, gosh, I must try. Yeah, I think it's cutting out carbs, not trying carbs, Bex, just to be clear on that. Right, shame to show this one now. Another one, Amy, if you're out there, lose is LOSE, yeah, because we've got a couple of looses here. Now, I know why. It sounds like it should be double O. Lose sounds like it should be double O, but lose has only got one O. So is it better to lose weight prior to having a breast reduction? What if I struggle to lose weight prior to surgery? Absolutely better to lose weight prior to surgery, no question. What if I struggle to lose weight prior to surgery? Well, if you struggle to lose weight prior to surgery, you're not alone, because I think everybody struggles to lose weight prior to surgery, and it's extremely hard to lose weight prior to surgery. And what I try and do is I try and get on a conciliatory agreement between us, that we're both trying to get the best result. I don't have to tell you how expensive this surgery is. God only knows what a breast reduction costs. Arm and a leg, we're talking an arm and a leg for a breast reduction. So it's an expensive op, not to mention the physical, emotional, and God knows what trauma you have to go through. It's a big deal. It's a big deal. There's healing, there's scarring, there's all sorts going on there. So you want to have the absolute best result possible. And because this is elective surgery, it's planned surgery, it can be done at any time. It doesn't matter if we do it tomorrow, or if we do it in 6 months, or if we do it in 3 years. It really doesn't matter. You're not going to have any adverse effect by having it later, except for the fact that you're going to live with your breasts for that time. So obviously that's going to be an adverse effect, but there's no medical reason to do it sort of urgently. It's not like appendicitis or something. So we have to do it when you're in the best situation, when you're in the best state. And so ideally you need to lose your weight first, because when you do a breast reduction, you will always say to people, where do you want to be? What do you want to be in terms of size and stuff like that? And you get an idea, and you try, when you do the surgery, you try and make the size look good. You try and make it look good, try and make it keeping the frame. Can never guarantee the size. If you say I want to be a C cup or whatever, might never guarantee, but you try and make it look right. If you lose weight after surgery, it's unpredictable what can happen to your breasts. They might get smaller, they might not, they might stay the same, but they might get smaller. So that is one thing. And also, if they do get smaller, if you do lose volume in your breasts by losing weight, then they might droop a bit, because part of a breast reduction is a breast lift. So you tighten the skin as part of a breast reduction. So if you lose weight after surgery, you might find that they droop a bit. And that's not great, because if you try and make the shape better when you do a breast reduction, so then if you lose a significant amount of weight after surgery, then the shape can be affected and the size can be affected. Also, the higher your weight, the higher your risk of complications. So if you can lose the weight first, then you're going to have less risk of complications, more predictable size, and more predictable shape. So there's lots of reasons to lose the weight prior to having the breast reduction if you can. What if I struggle? You know what? We need to get weight loss people. We've got enough here tonight. We need to get weight loss people in the clinic, because it's a nightmare what to do if you struggle. It's a whole thing in itself. Weight loss. It's not, again, a bit like faces and anesthetics. It's not my forte. You know, faces, anesthetics, and weight loss are not my forte. But it is a big deal, and it is difficult. I know that. But all I would say is, yes, if you can lose weight before surgery, it would be better. Lost control of Instagram, lost control. Or the worst thing, I don't have, lost control, do not have control. Right, okay. Cut out carbs. I don't have control. The worst thing is that I know my car. Me and my cat share foof. 9K with you, JJ. Breast reduction, 9K with JJ. Okay, there you go. I told you it's an arm and a leg. I told you it's expensive, didn't I? Can you make a big person's reduction small as in a B cup? Bex, no. Simple answer, no. First of all, big person, people often, when they have breast reduction, they often say, I want to be really small, I just want to get rid of them. A B cup on a big person would look weird. You don't realize what a B cup would look like. So on someone who's got quite a big frame, it would look quite flat. It would lack projection and it would look weird. The cup size is related to the back size. So a B cup is not an absolute size. A B cup is different on different people. So someone with a wider chest will have a bigger breast to be a B cup than someone with a narrower chest. It's related to the size of your chest. So a B cup on a big person, it would look odd. So number one, it would look odd and it would lack projection. So what I try and do is I try and make it into a nice shape and I try and make it look in keeping with your frame. Number two, when you do a breast reduction, you keep the nipple on a pedicle, on a stalk of tissue that you then move up. And that pedicle has volume. So if you've got very large breasts, in order to keep the nipple alive, you're still going to have a fair volume of breasts afterwards. So I'll show you some photos of some of my cases where you can see them post-op and you think, crikey, they've had a breast reduction, they've got huge breasts. And then I show you the pre-op and you'll be like, ah, right, okay, they were enormous. So unless you do a free nipple graft. If you do a free nipple graft where you take the nipple off, then you can make it smaller. So that's one thing. But if you take the nipple off and put it back as a graft, which I think is what people think you normally do for a breast reduction, but it's actually quite rare, at least in my hands, it's quite rare to do a free nipple graft. But if you do a free nipple graft, then the nipple will lack sensation and it will lack projection, and it might become a bit depigmented. It might lose a bit of its color. So there are issues with doing a free nipple graft, but it does make you can get it smaller. So that might be something to think about if you want them really small. But you need to also think about the shape. Because a lot of people say I want to be as small as possible, but I don't lose much, especially for bot boys. It's not easy, or weight loss surgery isn't easy. No. Yes, I hate mine. Massive. Need them gone. Yeah. Oh God. Keep on pressing the wrong button. Oh God. Oh, I don't want to block. Sorry. Nearly blocked you, but oh God. Cancel. I keep on trying to like the comment and nearly blocking you. Louise Mitchell, how you doing? Good to see you. Bex, yes, you should know me by now, JJ. 42 centimeter drop. Yes, it's all there, Bex. It's all there somewhere. It might not be at the front. It might be a bit further back. It's all there though. 42 centimeter drop. Not messing about, Bex. It's got a 42 centimeter drop, so that's specialist. Right, here we go. Sarah B, I can be your weight loss specialist. There we go. We got a job opportunity there live. You saw it here first, guys. This is all really interesting and useful. Thank you, Sarah B. What we got? Well, weight loss. Do we offer gynecomastia spelt wrong? Come on, Lorraine. With the spelling here, you may well hide. Where is she? Right. So, I mean, I don't know where to start with the spelling of that. Gynocamestia. Sloppiness. Right, Amy, we'll be having words tomorrow. Anyway, we get the gist. Gynecomastia, excess breast tissue in a male. Do we offer gynecomastia correction with transverse skin excision? This is a weird question. I've got a feeling that Amy's asked this question herself, which is odd because she's completely spelled gynecomastia wrong. But would a patient really ask that question? It's a bit of an odd question for a patient to ask. Anyway, we're not going to go into the motives behind the questions. We're just going to answer them. So yes, so basically gynecomastia is breast tissue in a male. Usually you address the breast tissue, which is dense glandular tissue, which you can often feel behind the nipple, and fatty tissue. And you do that by doing liposuction to the fat and then making a little U-shaped incision on the areola to take out that dense glandular tissue. And that leaves a beautiful scar, very hard to see. You can get some really nice results by doing that. Now, the transverse skin excision question comes in when people have got an excess of skin as well as the glandular and the fatty tissue behind the skin. So it's not that common, to be honest with you. The majority of people with gynecomastia just need the gland and the fatty tissue removed, and the skin to a degree will recoil. But if the skin if you've had a significant weight loss, or if the skin has lost some of its elasticity, or if you've got very big breasts, then we might need to cut the skin out. Now, if we cut the skin out, the problem with that, it gives more scarring. There's two ways you can cut the skin out. You can do a circumferential skin excision where you take a donut of skin and then cinch it down, gives sort of like a puckered scar around the areola. And then there's a transverse skin excision, which is probably the most comprehensive, if you like, way of doing it, where you take a large ellipse of skin. It is the best way to contour the chest if someone's got excess of skin, but it does give quite a long scar, and we have to move the nipple. And again, well, not again, but we often use a free nipple graft in those situations, because you don't want to have a pedicle behind that nipple, because it might give a bump and might not look great. So so yeah, that is an option, and not that common, but definitely an option. Well, so you really wouldn't like to take on 42 centimeter job, as you say, it's a specialty. I mean, I wouldn't mind taking on a 42 centimeter job, Bex. It's just a big job, that's all. But it would, and that sort of, if that's a fact, if it's sternum notch to nipple is 42 centimeters, that sort of situation that I would be thinking about free nipple graft, to be honest with you. As having said, I don't do them very often. Those are the sort of patients I would do it on. Sort of once you get above, 35, 40, then you're looking at serious distances for that nipple to move. So you might want to think about a free nipple graft. I think you should do videos of you doing surgery, a day in the life of JJ. So do I, Susie. So do I. And we need to. We've done a few, Susie. We've done a few. And we need to get back into them and doing them. Yes, you're absolutely right. Yes, you've seen from my photos. Have I, Bex? As I say, it's all there, Bex. Not sure where it is there, though. That's the problem. It's in there somewhere. But Corinne, yes, I do need to do videos. Yeah. No, Susie. The reason I say Corinne is I think Corinne said that before. But yes, Susie, we do need to do videos, and there are some, but we need to do more. And again, I was thinking of Corinne because I was talking about doing a day in the life of last week or week before, and she was saying, yeah, go for it. But they weren't that up for it because they thought it was like every day I was going to do a video, but it might be a bit excessive. But yeah, we need to get a videographer in. Do we offer removal of fat located under the armpit? So again, this is a question, but what I think people often talk about when they talk about low fat located armpit. So bottom line is, do we remove fat located anywhere on the body? Yeah. Bottom line is, try and think of a place we don't remove fat. Intra-abdominal, inside your bowels, in your omentum. That's about the only place. In your brain, got any fat in your brain? I don't know. But anyway, that's it. I'm trying to think of a body cavity where we wouldn't remove fat. So basically, we remove fat from anywhere, basically. But specifically this question, often women have an extra bit of fat here, underneath their armpit here. And it's actually accessory breast tissue, rather than, they often think it's a lipoma and things, but it's like a sort of sausage-shaped piece of fat just underneath the armpit, above the bra, and people don't like it. And that, I mean, still we can remove it. It's a bit of a thing to remove that, if that is what this question is about. That specific problem there with that fat just there underneath the armpit, because it can be a bit of a challenge to know what to do for those situations, because removing fat involves liposuction, and liposuction, you can hide the scars, particularly in these situations. You can put them on the lateral chest wall, in the abdomen, in the armpit. I'm trying to cry. Armpit or the lateral chest wall. But the problem is the skin. So if you don't address the skin, if you're just taking the fat out and you get a bit of hanging skin, you might, don't like that. So if you want to cut out skin, a bit like the transverse skin excision thing, you will give a scar. And the problem with the scar is we're trying to hide the scar. So we're trying to hide the scar in the armpit. But if you hide the scar in the armpit, then the excess skin's often up onto the chest wall here. And so we've got to think, oh, what are we going to do? We're going to cut all the skin out, but then you're going to make a scar there, especially bilateral. Scars both sides like that. Doesn't look great. So it's, oh God, what are we going to do? So in my hands, I often will try and avoid the scar. It depends on how bad it is, how bad the excess skin is. I'm trying to avoid the scar, because much as you say, I don't mind scars, I'm like, oh, it doesn't look great bilateral. One side you might say, oh yeah, I've hurt my arm, but bilateral scars can look a bit odd because it's above your bikini, it's above your bra. So try and avoid scars in general in that area, and we should probably just do lipo, or try and do a limited excision in the armpit and try and, make the scar hidden. but there's a risk there might be a bit of a bulge of skin there. So it's something we have to have a chat about if that is what you've got, or you might just have a bit of fat located in your armpit, in which case we just cut it out as normal. But if it is this accessory breast tissue, it's in a funny area, so it needs a bit of thought, bit of discussion. Sarah B, what you got? How long after breast reduction would you do post-op check? I'm not local, so I'd have to travel to appointments. So Sarah B, you have a lot of dressings on. So first of all, Sarah B, I say to everybody, go local. So as a rule, if you, ideally go local is my number one bit of advice. So look for someone locally. There's lots of good plastic surgeons around. If you want to know what to look for in a plastic surgeon, well, funny you should ask, because someone's written a book. I happen to have a copy here, my friend. Okay. Never accept a lift from strangers, written by this guy here. Yeah, that's him. So, but look for a plastic surgeon. BARPS members, BAPRAS, these are how you find plastic surgeons. But in answer to your question, post-op checks. So you have the surgery. Try and avoid using drains for breast reductions, but for bigger ones, I sometimes do. You might be an overnight if you've got a drain in. Not necessarily, though. Might be able to go home same day if it's a smaller one. And then normally it will be a week post-op to see Vicky, clinic nurse, to take all your tapes off. You'll have all these tapes on. Now, if you really wanted to, you could do that at home if you're up for it. But you might say, oh, crikey, no, because it is a week post-op. But you could do that at home and then take a photo and give us a ring. But, usually people will come to clinic for that, take the dressings off. And then normally the post-ops checks is 6 weeks. And this is with me now, 6 weeks. Then 3 or 4 months later, then 6 months, then 12 months, then yearly. And then we keep on the checks yearly. Now, to be honest with you, Sarah B, all of those checks can be virtual. We can do video calls, phone calls. Now, I like seeing people. I like seeing you. And obviously, if you've got a problem, if you've got a bump or your scars are a bit red and stuff like that, it's always best to see you, or you can send us photos and things. So I will see you for any or all of those. Kelsey, I hope you're putting your feet up. But if you want to, we can do those virtually. So you wouldn't have to travel, especially if you're traveling a long way. So you could just do those virtually if you wanted to. But that would be the normal post-op hygiene for follow-ups. Corinne did say that before. Glad other people think so. Yes, we did have the discussion, didn't we? JJ, you can do my surgery on video. I give permission. There you go. You heard it, everybody. Bex is given permission. How would that work following breast reduction, JJ? What's that now, Corinne? The accessory breast tissue. What are you talking about? How would that work following breast reduction? So accessory breast tissue, you wouldn't address accessory breast tissue during breast reduction, or so you still have it. So you'd have to have that discussion prior to breast reduction to say, what are we going to do with this accessory breast tissue? Are we going to do some lipo to it? Are we going to excise it? Are we going to leave it? So I assume you're talking about accessory breast tissue, or are you talking about videoing stuff? I don't know. Would you do arm lift, thigh lift, wobbly neck? I don't do wobbly neck, Bex, sorry. Arm lift, thigh lift, yes. Not at the same time, though. People often want that sort of stuff at the same time. Both arms, both legs out action at the same time. I don't think that's good. But arm lifts and thigh lifts, yes, but I don't do wobbly necks. Kelsey is resting. I hope you're okay, Kelsey. I hope you're home. Hope you made it. Well done, you. Get off social media, Kelsey. Get a bit of Netflix on. That's what you need to do. That's okay. 2 hours away, not the end of the world. Yeah, so you'd have to come for the consultation, although we're doing them like this now, Sarah. But at some point, I'd have to see you for a consultation. Then obviously you'd have to come for the surgery, and then you would do the appointment with Vicky a week, and then the other follow-ups could be virtual. Obviously, if you've got a problem, we'll see you. No problem at all. But if you haven't got problems, we can do them virtually. Can it be addressed separately after BR with lipo? Yes, it can, Corinne. I think you're talking about accessory breast tissue now. So yes, it can. It can be assessed separately after BR. Absolutely no problem at all. But as I say, the thing about liposuction is that it doesn't take the skin out. So if you have a bit of extra skin here, that's a discussion we need to have. I'll take it offline, yeah. Bex, what did Kelsey have done? Hope you're resting up. Oh, God. Don't want to get... Bex, I can't... that's a bit like... Yeah. Louise, thank you. Louise, big up yourself. I'm thinking about you. I hope you're well. I hope you're well. I hope you're okay. I'm going to like that comment there, Louise. Okay, Fab. Back in a few weeks. Can we chat then? Of course we can, Corinne. Of course we can. Anytime. I think this is amazing. And how long after extreme? Lose? Yeah. Kelsey, you here? Kelsey is here. I think Kelsey's hiding. Kelsey's under the pillows. Kelsey, do a runner. They're after you. Right, guys. On that note, can you get mummy now? What is going on? Gastric, are you just mummy now? Are you posting before you finish the writing? May. Can you get mummy May? I don't know why I'm liking all these comments. I don't know why I'm liking them. Oh, Kelsey, what's going on? Right, okay, guys. On that note, I think I'm going to put my feet up. Oh, God, I pinned it. What does that mean? Unpin. Oh, my God. Make mover. Make mover. Yes, we can, Gastric. We can do mummy make mover. Yes. So mummy makeover is basically a tummy and a breast op. And that is a doable thing. Quite common. Well, maybe not at the moment, but of late, it's been quite a common thing. Great. Run. Yeah, I think Kelsey's running. Jackie, great to have you here. Lovely. You're here from beginning and end. Thanks, Father. Look at that. See you in 4 weeks. FFS, what's that? Is Gordon Ramsay on? It's Thursday, Gastric. Gordon Ramsay's on Thursday, love. Future Food Stars. Is that what you're after? Yeah? It's Thursday night, Gastric, yeah? Right then. Right, God, I'm losing it. I'm losing control. Nicola's here. Good to see you. Oh, hi. Didn't know who you were when you say Nicola Charlotte. Well, and then I saw the picture. Get well soon, Kelsey. Oh, God, I keep on. Right. Oh, God. Oh, I'm pressing all the wrong buttons. Get well soon. Right. I'm going to sign off. I hope you're okay, Nicola. Good to see you. And yeah, I think I've pinned that comment. Why did I pin that? Unpin it. Take it easy. Yeah, I'm going to have a lie down now because that's been a bit hectic there. So love you big time. Nice to see you, Soph. I know I pinned you, Bex. I'm trying to do the hearts and it's pinning and doing all sorts. Oh, that's pinned that one now. I'm pinning everything. I'm pinning it all over the place. I don't even know what I'm doing. Right, guys, listen. Thanks for caring. I will see you the same time, same place. So God willing, next Tuesday.